Dr. Chaudhry, you are now recognized for 5 minutes.
Thank you. Good morning, Chairman Bergman, Ranking Member Custer, and members of the committee. Thank you for this opportunity to discuss the important role that state medical boards play in the protection of the public and how, working together, we may be able to better protect our veterans. I'm pleased to mention that I served 14 years in the Air Force Reserves, trained to be a flight surgeon, and have more than a passing familiarity with issues related to healthcare needs of military personnel and veterans. My organization, the Federation of State Medical Boards, was founded in 1912 and represents all 70 of the state medical and osteopathic regulatory boards in the United States and its territories, including Puerto Rico, Guam, the Northern Mariana Islands, the U.S. Virgin Islands, and the District of Columbia. The mission of the FSMB is to support its member boards as they fulfill their statutory mandate to protect the public's health, safety, and welfare through the proper licensing, disciplining, and regulation of physicians and other healthcare professionals. In addition to licensing physicians, state and territorial medical boards are empowered to investigate complaints or reports about physicians who may be incompetent or acting unprofessionally, to discipline those who violate the law, to work with local and federal law enforcement where appropriate, to conduct physician evaluations, and to facilitate rehabilitation of physicians when appropriate. All of our member boards engage in an ongoing cooperative effort to share medical licensure and disciplinary information with one another by regularly contributing data to the FSMB's Physician Data Center, a comprehensive data repository that contains information about more than 950,000 actively licensed physicians in the U.S., including those who work for the VA. The FSMB applauds the noble mission and dedication of the VA and its many personnel in serving the nation's 9 million veterans, and we believe strongly that veterans deserve the same level of quality health care and regulatory oversight and accountability that is available to the general public, if not better. We read with great concern the October 11 investigative story in USA Today. While we are pleased that the VA, through FSMB's Physician Data Center, has had access over a number of years to comprehensive licensure and disciplinary information about physicians who work for the VA, more needs to be done to improve the sharing of information from the VA to the state medical boards that would expediently and efficiently identify unsafe providers operating within the VA system. While the dearth of timely information sharing from the VA is not unique to the VA, civilian hospitals, health systems, medical directors, employers, and all physicians and healthcare providers can and should do more and do a better job of sharing concerns about incompetent or unprofessional doctors. We note that the VA has had policy in place for more than a decade specifically requiring such sharing. In consultation with several state medical boards, we have confirmed what has been reported by the GAO, that the VA does not always alert state boards in a timely fashion about violations, disciplinary actions, or suspected violations of a state's Medical Practice Act. While the VHA handbook outlines notification requirements, in practice, the state boards tell us, many VA sites have not adhered to these standards. While it is important to note that each state board's relationship with their local VA facilities tends to vary, and some are a little better than others in terms of information sharing, we have found it rare for a board to receive upfront or helpful information from the VA in a timely manner. When information is shared with a state medical board, we have learned it is often well past the 100-day notification requirement designated by the VA. These gaps in communication between state medical boards and the VA are of significant concern to the FSMB, and we sincerely hope that we can work with our boards, the VA, and Congress to address this issue and overcome any perceived impediments. Providers who are unqualified or unsafe to practice medicine in the VA should not be allowed to practice outside of or elsewhere in the VA, nor should such providers be able to conceal their disciplinary actions with secret settlement arrangements. Proper notification of provider disciplinary proceedings within the VA to the appropriate state medical boards and the National Practitioner Data Bank will help ensure that unsafe and dangerous physicians are identified and prevented from also treating patients outside of the VA. The FSMB commends Congress for recognizing these deficiencies and for moving swiftly to rectify them with legislative solutions. The FSMB has endorsed H.R. 4059, introduced by Chairman Rowe, House Republican Conference Chair Kathy McMorris Rogers, and Congressman Bruce Poliquin, as well as S2107, introduced by Senators Dean Heller and Joe Manchin. Chairman Bergman, thank you for the opportunity to testify before the committee today. I look forward to responding to any questions you and the other members of the committee may have.